Welcome to the Teaching Value and Healthcare Learning Network. Join us to hear leaders in the field share practical and tangible advice about how to develop engaging curriculum and health system innovations to train a new generation of healthcare providers from diverse specialties and professions skilled to deliver high-value care. With national concerns about rising healthcare costs, as well as overuse, underuse, and misuse of medical care, Costs of Care and the ABIM Foundation created the Learning Network as a space to share ideas, educational materials, and strategies in an open forum. Our goal is to discuss ways to get started, implement, and sustain feasible innovations in teaching and training and value at your institutions. I am Reshma Gupta, the Director of Evaluation and Outreach at Costs of Care, and I'll be moderating today's webinar. Today, we will share an innovation improving price transparency. We are very excited and honored to have Dr. Yoshimi Anzai, who is here from one of our winners of the Value Challenge. She is a professor of radiology, associate chief medical quality officer, and adjunct professor of population health sciences at the University of Utah. She will be sharing her program, the Interactive Price Transparency Tool. Yoshimi, I'll let you take it away to share an overview of your initiative.
Thank you so much, Reshma. Really great to be joining this Cost of Care webinar. I'd like to really show what we have done at the University of Utah Health to improve price transparency, illness or injury, and I go to a hospital and they're seeing a physician, the physician ordered test or procedure they recommend, and they go through a whole process without knowing how much they have to pay. And this is a very unusual circumstances when you compare to when you purchase something that you know exactly what you're getting and also what's the satisfaction by the other consumers or how much they have to pay. So they are agreeable prices, but not in the healthcare. So this is really hurting patients and also family member, because after the care is all done, a month later or a few months later, they receive the bill. And then that could be the prices that they did not anticipate. So those kind of situation really creating a lot of bankruptcy related to healthcare expenses, or patient have to sell the house, or patient have to reduce the housing to apartment or something like that. It could happen all the time. So at University of Utah, we try to make that process to be much more transparent before the care is taken, so the patient know what their expense is before committing to go through either test or procedure. So I want to show that how we did it, and also what is the sort of notion behind this price transparency. So one aspect is really about disclosure of price, because of all this healthcare transaction and not knowing how much, and later on you get surprise bill. And that's not really right for the patient. And I think it's really a terrible situation for anybody who has to go through the medical care. They know that how hard it is and how expensive healthcare is. And our leadership really thought about not just the price transparency, but what are the patient care, patient-centered care looks like in a healthcare. So they challenge all of us to say, what is patient-centered care looks like to environmental services or valet parking or just pre-surgical, the team, what is the patient-centered care looks like? And then the revenue cycle and bidding folks thought about this patient-centered care by themselves, and it said, well, maybe having the prices or out-of-pocket expenses they know would be the best for the patient, and then we'd be able to discuss that option for reducing a cost or having an alternative test or procedure. The other things that we did in 2018 is the really value survey. We talk about value-based care, value-based payment a lot, but we really don't know what is the value is. And we survey over 5,000 patients, 700 the executive, and all of that and we published it in a Harvard Business Review. But we ask the patient what really the most important things when you're receiving healthcare. The number one answer was my pocket expense is affordable. And this is more than my health is improved or I trust my doctors. Those are the things that we think it's important. But for patient, because of the high healthcare expenses, the out-of-pocket expense is the most important things for them. And so really it makes sense for us to make something for our patient, being able to understand the cost to them. So the other things though, the price transparency, we talk about a lot in the price transparency in the healthcare, health policy, health economist, and a price transparency will reduce the total spending of the nation. That's a little different than what we talk about price transparency to our patients. And the other price transparency that the payers talking about is more about price shopping. They give you a price for hospital A versus B versus C versus D, and then kind of give you a patient to choose most likely steering toward a lower price hospital. Mm-hmm. And that is more shopping, price shopping. And I think that certainly that is a potential impact if you try to reduce the own expenses. They can choose lower price prices. Only things though, they don't really know the quality of care or they may not establish the physician relationship. So that's a different kind of price transparency, or in a way that the payer-driven price transparency. Our price transparency is really more serving for patients, getting a patient the right information. Since we don't have other price from the other hospital, we only know out-of-pocket expenses for patient given us services.
That's great. I mean, that background in terms of really being patient-centered and coming from the leadership to develop a program that truly has that message more than running after necessarily, regulations or kind of policies coming out and kind of being proactive about being patient-centered. Can you tell me a little bit more about what specifically the tool was that you developed and how it was created, what data and things it took to build it?
I think our price transparency is really getting the type of, if you go through university with the price transparency tool, or you can Google it, and you can enter as a guest, or patient can go through my portal, and then they are able to select a procedure and then able to enter some of the insurance information. And we took that kind of past sort of the allowable payment, and then based on the patient's unmet deductible or co-payment, we calculate patient expenses. It is not about how much we get paid from payer, either Medicare, Medicaid, or private payer. Well, we use that information to create what portion goes to patients. But really the price that we shown in our website is the patient expenses, patient out-of-pocket expenses, not the amount that we pay from private payers. Mm-hmm. I think it was a lot of work around the revenue cycle team. Really huge credit to this our revenue cycle team led by Cassie Dallas. And then really they try to serve better for patients and then providing a more accurate information. So when patient goes through my portal, my patient portal, my chart, and then all the information about patients' unmet deductible or type of insurance is all in there. So they don't need to type any of the unmet deductible. Many of the patients may not know exactly how much I have unmet deductible. And then we were able to calculate based on their information.
Great. So it sounds like having the information and the data internally from, the revenue team and the finance department there, as long as you had that information then being input by the patients, you could calculate that amount more easily. Was that something that was done across all areas, or was it focused on a certain number of procedures or things that were done, services provided?
Certainly, I think we started as more ambulatory side of care, and also particularly for diagnostic testing, lab tests, imaging tests, but including some of the ambulatory surgery. We have, I think estimate would be much easier when the variation of cost or actual payment is very uniform or less variations. Because if the variation is wide, then an estimate would be very inaccurate. So we started from something like a very consistent procedure, such as cataract surgery, a vaginal delivery, or joint replacement, which has a very little variation compared to very serious illness like cabbage or heart transplant. So we tend to be more focused, a little bit more diagnostics testing, lab tests, or ambulatory surgery. But now we're expanding to almost 6,000 procedure.
Wow.
Few. So I think it's trying to make the list comprehensive as much as possible. The other things that are very important to keep in mind is having that tool to be understandable by patients, because sometimes we have a lot of medical jargons or code that a patient don't understand, and then they don't know what I'm getting. So all the words of explanation of procedure, the test are written in a very patient-friendly fashion, and so that they understand what am I going to get. So that's also very critical, because our really tool is targeted to
How are patients involved with the process? Were they shown the tool and provided any input on kind of development?
That's an interesting question. I do not believe that a patient was involved from the beginning of the designing, but I think that designing, it was a very important part of the process, and I tried to make that tool to be patient friendly. Not too many not many sort of a question to be asked, then I make it simple. And also there's always the telephone number for them to call back, because many of the patients may not really understand how to navigate a system, and then they can make a phone call. But I think that customers' view is very critically important for those kind of tools, that are patient-facing tool.
Great. And, for other listeners to this webinar might be thinking, how would I even get started doing something like this? What resources do you think are some of the key vital pieces that you needed to do this? And what leadership support did you need?
Right. So that's a good question. I asked that question to Cassie Dillis, she's leading this revenue cycle team, and they really did not get an additional FTE. Surprisingly, the whole team took, this is what we're going to do this. And then they spent a lot of time with data warehouse folks to design and navigate, and also work with the marketing folks of what the patient view looks like. So they really created a team without adding additional FTE to create this tool. I think it's really mainly because of the passion of creating something to serve a patient better. But leadership was incredibly supportive. Sometimes you feel a little bit of, some people may feel like, well, we're going to expose those numbers to public-facing website. There's some uncertainty involved, but I think our leadership are fully supportive of having more transparency. And I would say University of Utah is unique in a way that we posted even press scanning for all the individual provider to public-facing website for many, many years. I think it started in 2012. So all the provider has a 5-star rating, 4.5 versus 3.9, and what kind of area that there's some weakness. So in a way that our culture of being transparent to our patient we serve is kind of like hardwired. But still, I think I was shocked to see that this kind of tool was developed without additional funding.
Yeah, I mean, I think that's a great point. It's that culture that's there, right? That oftentimes this kind of price transparency is one of the harder things to move forward with transparency and data.
Hmm.
And so for other institutions that haven't really done much with transparent data from the
Hmm.
beginning, there
Hmm.
this may not be the first thing that they address, but
Yes.
something that, you needed to have that culture. What was there any education or training that the clinicians or staff received about this new tool? Because patients might be coming in saying they're using
Hmm.
this to get them familiar with it.
Right. So I think a price transparency tool, something like that, the one is really user type patient would be the user, but I think the other customer would be a provider, particularly for ambulatory primary care provider. They're talking to patient about whether or not that he or she need brain MRI for headache. And I think that in a typical sort of, well, maybe based on this guideline, we should do it, but there's no kind of cost discussion at the primary care. But this kind of tool allow you to say, okay, so you are Medicare, and then this is the allowable, and this would be the expense, and then having that piece of information to discuss whether or not we should get MRI or not would be not necessarily that's the driven, but additional information so the patient do understand what's the cost to them. So the primary care doctor aware that the tool, although we could actually go further in the next phases to say this is the tool. I show it to medical students and they're so excited. You
Yeah,
could not believe how excited they are. They're like, oh, so this is so cool. I did not know that we developed something like that in University of Utah. So our students are incredibly engaged and excited. The other
great.
thing I want to mention is this kind of tool, when you're looking at the who are accessing and who are using this tool, it is shocking, well, not shocking, but it's younger patient. We have a lot of people who access to a tool and calculating estimate about 25 to 35. And the next phase is 35 to 45. So it's a younger the patient, more keen to those kind of online price estimate tool. And the senior people, not so much. So it could be some cultural things that the younger people tend to have, get used to having access to information in a cell phone, mobile devices, and then getting a checking, comparing the prices. So this new generation of folks, when you're coming to the healthcare area, they are much more cognizant about those tools, more so than baby boomer.
Yeah.
So that's
I,
something we should keep in mind. It may not be a huge attraction right now because much of the healthcare consumers are older, but generation changes the next 10 years or so, and that's going to be most likely change drastically.
that's so interesting that you find that. And I was also thinking as you were talking that I wonder if some of those younger folks also may have plans with higher deductibles, or there are other
Absolutely.
things too, or they're soon out of college, so their savings are not as much, so that really comes into that placing
Absolutely.
them risk at paying rent and things of that sort.
Yes.
um, One last question for you is, what do you believe your next steps might be before we wrap up here?
So next step would be, I think I would think it's one of the is dissemination of this kind of tool to broader provider. And then the provider awareness is a little bit, we could do more than that. And also the patient education that we could get a feedback from patient and say, where do you feel like you could not figure it out so that we can actually make the tool a little easier. And transition to EMR, a patient portal, my chart, really made us so much more fewer question for patients. So it makes it easier. But still, we have more than half of the patient, almost close to 60% patient go through this public website as a guest. And then 40% goes to my chart. So we were kind of more pushing toward a the patient portal side. But certainly there are a lot of shopper or just out of curiosity what the out-of-pocket expenses at University of Utah. So there are a lot of people from California accessing to our data and so forth. But really the more patient engagement and also dissemination of the tool and education to provider. That would be the next step. We have over 600 procedure, which probably be enough, because sometimes when you expand it too many procedure, like 1,000 and 10,000, then tool may not be as effective. We try to nest it a procedure such as radiology or lab or endoscopy, so that the people can choose and then filter into certain domain, which I think it makes it a little more easier.
Great. Well, thank you so much. We're so honored to have you here and sharing your new tool with all of us. And, you know, we wish you all the well in taking those next steps.
Thank you so much for having me.